And so good afternoon, everybody. Welcome. This is the last in our series of Profiles in Social Innovation. If we have not met before, my name is Jim Kuchar. I'm the Program Director for the Masters of Science in Health and Social Innovation and also an Associate Professor in Social Innovation in the Graduate School at the University of Maryland, Baltimore. We're happy to have you. As Taylor said a minute ago, if you're comfortable putting your camera on, we'd love to see your face. It's a lot easier to get your reactions to know whether or not my bad jokes are working. But if you're not comfortable, that's fine too. We're happy to have you here. And I am extremely happy to have my very good friend, comrade in arms, co-conspirator, and amazing person, Shantell Roberts, with us here today. And Shantell and I are going to chat for a little while about the amazing work that she does. And our colleague and co-conspirator, Taylor DeBoer, is going to monitor the chat. So if you have a question along the way, feel free to drop it in the chat and Taylor will grab it. Or if it's really, really burning, feel free to just unmute and hit us up. And then we will have some time for open conversation afterwards with Shantell. We'll go probably till about 20 of or so in conversation and have the last 15, 20 minutes or so for open discussion. So Shantell,
Hi.
hello. In addition to everything else, I got to tell you folks, this woman has the most consistent, optimistic energy that I have ever experienced. And it's always just so much fun, Shantell, to have you in the virtual room or in the physical room back when we used to do those things. And it's just great to have you here. So the name of your organization is Touching Young Lives.
Yes.
So just briefly, without going into product details, just in sort of general service lines, how do you interact with young folks and what does young mean like in terms of age range and those kinds of things? Just sort of sketch that out for us for a minute.
Absolutely. And first and foremost, thank you, Dr. Kuchar and Taylor, for inviting me into your very sacred space, that of UMG. So I'm always honored to share this space with you. My name is Shantell Roberts. I'm the founder and executive director of Touching Young Lives Incorporated. But before I was that, I was just a regular 24-year-old Baltimore City native. um, I gave birth to an amazing daughter in 2009, and I was, like most new parents, clueless. I was still at home with my mom, and her dad got this amazing job opportunity to relocate to Jacksonville, Florida. And so for about a year, we did this dance between Baltimore and Jacksonville, um, co-parenting in a way because he had relocated, um, but it was an interesting ride. And so one weekend, my daughter was at her dad's mom's house, and my dad picked her up and said, Shan, I think she's sick. And so, as any mom would do, I go to the store and I purchased everything under the sun: Pedialyte pops, Tylenol, everything that you could possibly get for a sick 1 year old, because I'm a working mom and I needed to go to work on Monday. And so I took her to the urgent care center, and they did a number of tests, and it essentially came back as a viral infection. And so for um, the last thing that I remember the practitioner saying that day was, if she's not better by Wednesday, bring her back. In full perspective, almost 48 hours after that visit, my daughter died. And it was devastating. It was absolutely devastating because I had done everything I was supposed to do. And so, in doing that, it was the biggest loss that I had ever had. It was the biggest loss that my family had ever had. And there were a lot of who, what, when, where, whys. And there's still a lot of who, what, when, where's, and whys.
Yeah, that never really leaves you, does it?
It doesn't. It never truly does. But I think what I did find refuge in was memorializing her life. And I did that by way of creating a nonprofit to prevent other families from going through that tragic process, that tragedy. And so, what that looks like, Touching Young Lives provides not only best practice education for families and caregivers of small children between the ages of infancy and age 5, but we also provide an actual tangible device to prevent infant mortality for our youngest population, which is um, 0.
So zero to five is how we define young
Yes,
in your world,
yes,
right? Yeah, because sometimes you hear young, and it could be teens, it could be different things, and of course, obviously, I'm sure everyone here shares our deepest sympathies on your loss, and I know it has dramatically shaped you and driven you, and that's one of the things that I think I want to talk about for a minute, because in the traditional nonprofit context, and you're not a traditional nonprofit, and we'll get to that in a minute, but in any person that seeks a path where they are trying to make the world better in a deeper, more social sense, there's always a need for empathy. There's a need for connection. There's a need for understanding what your what the people that you hope to help are going through, right? Because if not, you're just some bald-headed white guy parachuting into a neighborhood trying to tell people that you know what's best for them,
yes.
right? So obviously you've got that empathy, you know, to your core, in terms of understanding the challenges of young parents, and particularly young parents with sick kids. But you also have a very practical side to you, and to what you're doing, and I think that comes out a little bit more in the product piece
Mhm.
of what your organization does. So why don't you talk for a little bit about what the actual product is that you guys produce?
Absolutely. So after my daughter died, I created the nonprofit, and we would do very small scale activities, mainly providing education through. We would do Easter baskets, we would do small communal events, but nothing. We didn't quite have a product. It was um, very education focused. And so in 2016, I learned about the John Hopkins University Social Innovation Lab. And at this time, I had transitioned from my job at Morgan State to the Baltimore City Health Department. I worked at a satellite site, Healthcare Access Maryland, which, yes, HCAM, Healthcare
Yep,
Access Maryland.
yep, yep.
I haven't had like a real job in a long time. I don't remember the names of these agencies. And so, because when you do what you love, you never work another day in your life. And so,
No, you only have to, it's easy. You just, you only have to work a half a day, right? You just pick which 12 hours.
which 12 you're going to do.
All right.
And
So you were at Morgan, then you were at Healthcare Access Maryland,
mhm.
and you came across this incubation program, which our colleagues over at Hopkins run, which is very similar in some ways to the incubation program that we're building over on the west side with our program. So you had this experience, and tell us about what you learned in that experience.
So I was doing the incubator as well as working at the health department, and there were a few problem areas within the logistical program that I was running. So I was a safe sleep coordinator, which oversaw this huge lift from the Baltimore City Health Department around Be More for Healthy Babies, where they would provide pack and plays, which were these super big devices to families that didn't have a safe sleeping space for their infants.
I
And
can
while
play is like that little portable, foldable
absolutely, you can transport
baby
it.
crib place set
Yes,
thing, right?
and a
Yeah.
lot of families use them to sleep their infants that didn't have or don't have traditional cribs. And so there were a number of areas where those families would not qualify. If you lived in a 3-story home and you had a traditional crib but you slept on the first floor, you had a crib, so you didn't qualify. If you were in Baltimore County, you didn't qualify. If you made a dollar over poor, you didn't qualify.
I'm
And
sorry, a
so,
dollar over poor is what you said?
yes,
So let folks know what that means in economic terms.
absolutely. And so essentially, a lot of the state programs follow a federal poverty level, which is essentially $24,400, I believe it is. If you
Okay.
do anything over that threshold,
So $24,400 is the threshold. So if you made 24,405, you're out.
you're out, which eliminates a huge population of the most vulnerable families that need support. And guess what? They have babies also. And so that was always
Yeah, there's no
problematic
economic strata on producing children.
in how they don't come with manuals or supplies. And so
So,
while
you're at the health department. Let me just make sure I'm tracking on this, right? So you're at the health department, you're getting exposure to this world, and you're starting to do a deeper dive into some of the issues that these families are facing, in addition to your own history that you brought with you into that situation. And
Mhm.
now all of a sudden you come into this social innovation thing,
Yes.
right? And what does that add to the mix?
So they used to have a forum in late August, early September, where you could come with an idea and you could, um, for lack of better words, network with other like-minded creatives around these social ventures. And I don't even think we used that lingo then. It was just, I want to do a good thing, or I have an idea for a good thing, or a good product, or this is what I think is missing. And so you would go, you would have these great conversations and feel empowered. And so when I went, I had this idea of, okay, so I need something that can fill the voids that are bubbling up. I know I read about this crazy box thing in Finland, and it's kind of cool, but I don't think people would actually put babies in boxes. But
Crazy box thing in Finland. So what was that about?
the crazy box thing in Finland, so the Finnish population had been providing their expecting moms with box bassinets since the 1930s. And so
Okay,
essentially,
and so by box, we're not talking about the size box that a sofa comes in.
no,
We're talking, if I remember correctly, we're talking like the size box like you would have like to carry office files or a case of wine or something like that size.
absolutely. They're about the size of, if you think about a traditional bassinet, that's the same size that these box bassinets were. And actually, I probably will regret saying this, but they were not that cute. Okay. They were not that cute. But oddly enough, the data show that people, when they were presented with the option of having a box bassinet filled with resources versus $150 in Finnish money, 80% of the families always opted for the actual box bassinet with the resources inside versus the money, because they were empowered by it. It was so much more helpful, and it actually did help to cut down on cases of sudden infant death syndrome within that population.
So let's dive deep into that for a second, because I know it's absolutely critical to what you're doing now. So the Finnish government supplies this box.
Mhm.
Inside the box are various baby supplies, right? Because I hear they need stuff. Um, and but they found out that in addition to that, in addition to sort of the, hey, this is a nice, cool thing my government's doing to help me, they actually found a positive health outcome
Yeah.
through the use of that. So talk a little more about that.
So essentially, over the life of the last 50 years, let's say the last 50 years, there's been a number of updates to the recommended safe sleeping practices of infants, for families, for parents, for caregivers, anyone essentially that oversees a small baby. And so those updates come by way of saying, okay, sleep the baby on their stomach. And then they saw a drastic spike in the number of cases of infant deaths in the prone position on their stomach. Then there was an advancement to, okay, we'll put the baby on their side. And then they realized babies roll. And so that didn't work either because there was a drastic spike. While it was a decline from the prone position, there was still a spike in the number of cases infants were dying. And ultimately, they offered the recommendation of sleeping the babies on their back, and that was a world of a difference around um, a reduction in babies suffocating from bedding, from crib liners, from pillows, from co-sleeping, and for them own for their own selves.
Right,
And
right. So
so,
so we figure out the kid goes on the back. This is better for survival and reduces sudden infant death. What does the box bring to that equation?
what a lot of families at that time and even still now don't realize is that babies don't need to be in the bed or co-sleep with anyone. And so what that does, what the box does specifically is it's small, it's compact, it's lightweight, you can move it around. So wherever you are in your home or anywhere else, they have a safe sleeping space. And what that also does, it allots for it's minimalistic. It doesn't take up much space. And so for families that have limited space, that may be transient, may be homeless, they have a viable, safe option for their infants to sleep in. And quite honestly, in an already high risk scenario.
Right. And if I remember correctly, it also effectively constrains the child
Yes,
so that the rollover doesn't happen as
with
much.
developmentally as they get older, because typically they in my device as well as some of my competitors, they have the same weight requirements, so they're up until about 15 pounds, depending on length. Some infants they can stay in it until about 6 months or so. And so with that, that's around the age where a lot of infants start rolling and they can't. And so that was an unintended win, but we'll take it.
Right, right. So the Swedes figure this out. You're doing this work, you're trying to search for a way to become something more than just an information source. And you stumble across this thing with the Swedes that says, well, they're doing it over there. Right. And the thing that I love about that is I think a lot of times people think about entrepreneurs as people who have this incredible sort of lightning bolt experience where something is created out of thin air and whole cloth that has never been done anywhere before.
Yeah,
And the reality is it's much more like your experience where it was like, hey, they're doing it there. Maybe it could work here.
yeah,
Right.
it was. And in fact, I always give credit to Dr. Megan here because I was in a professional development session and she was the first person in the United States to roll it out at Temple University Hospital. And I loved her model and just how she was so, we're gonna do this. And they did it. And there were so many critics of her process, but it worked. And so what she did was she partnered with what is now a competitor on the West Coast, and they, in a very socially conscious way, provided every postpartum mom with a box bassinet as they were transitioning out of the mother baby suite. So basically, every mom that had a baby received a box bassinet. For the first year of my program, I would go quarterly and just observe the grounds and well, not the grounds, but the floor.
Mhm.
And I actually had this really interesting experience. One day, there was a mom that was getting her second box, so she had a set of Irish twins, which were two children less just about a year apart. And so I was able to ask her about her experience with the first box fest and that as she was getting her second one. So that was interesting, but it went very well. It lended itself really well in my process because that was a completely different environment, an environment that I aspired to have, or I thought I aspired to have, which would be the dissemination of these box vests, and that's at a hospital level. And I just didn't even know that that was a blessing in disguise that I didn't obtain any hospital partnership because I was able to get so much more quantitative and qualitative data in doing evidence based home visiting. Um, and having strategic partnerships throughout the state. I scaled tremendously through this alternative pipeline that I had never even considered.
So the model that you came across at Temple, as you're understanding this, is as you're coming out of the maternity ward, here's your box,
Yep.
right? And your original business model, and we'll talk about how the money flows in a second, but your original business model was to copy that and develop partnerships with those hospitals so that you would supply the boxes that the hospitals would then give to the family as they came home with the baby.
Yeah.
And that didn't work.
It did not work because there were a lot of variables at Temple. One, Dr. Hare is a doctor. And so she was able to say, for my patients, this is a service that I'm going to offer.
So
And
she actually prescribed it essentially.
essentially, this was what she wanted to do. And there was very minimal pushback from her with her institution. In fact, they fully kind of rallied around it. They made it academic. There were support groups, student groups. It was the data out of this world for a collegiate institution. And so
Right. And you didn't go to medical school, so that didn't work for you.
it didn't work for me. And so
So what was the pivot?
the pivot was I think shortly after I did the Hopkins incubator, I also became an Open Society Institute community fellow. And I think that made the world of a difference because I had to generate my own data. And in this field, it's really interesting. It's very much what comes first, the chicken or the egg, because in that environment, the reason why Megan's process and framework didn't work for me was because I didn't have any data to prove to practitioners. She was a practitioner. And so in that space, especially with this very vulnerable population of 0 to 5 or 0 to 1, especially without the data to support that this is a viable option and it's safe, and the Academy of American Pediatrics recommends it, which currently they still have a neutral position on it because there's not enough data to support them supporting it.
Which is
And
fascinating, even though because there's data overseas, but somehow because we don't have our own.
it doesn't work.
Yeah.
And so that was my what comes first, the chicken or the egg. And so with the community fellowship, what I was able to do over 18 months was act as a community health worker and hire other community health workers to go into the community to do a lot of the quantitative, qualitative data around, okay, what does the process look like to deliver that? How are families responding to it? Are there any type of behavior shifts, any type of cultural shifts or um, mindset differences around what the actual concept is, coupled with the education? And then if we can also provide them with continuous resources such as diapers and wipes and clothes and warm handoffs to other social service agencies, what does that really realistically look like? And I have to attribute that a lot to some of the research that I did in Cuba, in Scotland, and also in London, because these are socialist perspectives. They are all very much operating very different than our super capitalist world.
Mhm.
And so I wanted to see and unpack these countries that had very different social challenges, needs, how they address their people very differently, and how that would look in a city like Baltimore.
Right. So the hospital channel doesn't work. So the community health piece, just so people understand that, essentially what you're doing is going into a neighborhood with a box under your arm,
Yeah.
knocking on doors and saying, hi, are there any babies here?
Well, there was a pipeline for referrals. And so we
Okay.
were able to, what the pivot was for the hospital climate, especially, was in their post survey, because they always do a post survey before moms are released into the world. They would ask if the mom or the family had a safe sleeping space for the infant, and if there were opportunities for them to offer me a referral because the family had identified as not having a space. They would
Okay.
give
So
me
you got that data feed from the hospital. So when you knocked on the door, you at least had some
information.
suspicion that
Absolutely.
this was somebody that you might be able to help.
Yeah, it wasn't quite a cold call. not quite a cult.
Yeah, but still, this community health work is it's house to house to house, no matter how you slice it.
Yes.
So now the question that I'm sure is on everybody's mind, you were a nonprofit, now you're a social enterprise, right?
Yeah.
So how did that shift happen?
Well, it got really sticky because, as most people know, a nonprofit, you don't particularly have any ownership in it. It's the social good of the organization. The profit is to be reinvested in the social good. And the what got sticky was I was the shared intellectual property of this profitable idea and now tangible product. Yet when I went into the incubator, I went under the incubator under the nonprofit's name. And so it became an ethical thing versus also, this is my thing. This is my intellectual property that I am creating. And I think a lot of people, that was a realization for me and a lot of people in my cohort at that time, is that when you create things under a nonprofit, it lives with the nonprofit. And I can't stress that enough. Anything lives under the nonprofit. So if I get fired today, anything that I created under that or this organization that is not mine. And so it was very important that I created another legal entity and create a memorandum of understanding on what can be licensed between the two, because I
Mhm.
was the shared intellectual property. And that was challenging because it's okay. I wasn't a business person. I just wanted to do something good. And so legally, I was advised, no, there needs to be explicit language on what the nonprofit can license from this profitable arm, what that looks like, percentages of revenues provided to, like everything had to be explicitly listed. Um, but now everything works fine. It works fine
Well,
once it's on paper.
and this is one of the points I think that we talk about a lot in our program and in our world. One of the things that people don't realize about creating social value, about creating social good, it's easy to understand the term value from a sort of psychological or spiritual or social sense in terms of the traditional nonprofit, but there also is a place where it has value in actual dollars and cents.
Yes.
And that's kind of the aha moment that you had. So what are the dollars and cents side of the value now that you've got this social enterprise set up? How does that work? Where does the money come from? I mean, you're not just going to the back of the liquor store and picking up old wine boxes and putting padding and diapers in them, right? Somebody's paying for all this stuff, right? How is that working?
No, but that's so funny you said that, because when I was in the prototype phase and I was reaching out to cardboard companies and I would say to them, okay, and I would ask these like random questions like, what is the cardboard made of? Okay, so for the ink
It's
that
made
you
of cardboard.
is it water soluble? Like, is it recyclable? Is it eco friendly? And they would, okay, lady, why are you asking me these questions? I'm like, oh, well, I want to make box bassinets and put mattresses in them and sleep babies. And so I was the crazy person in the room. And so it would be like, well, we ship meat. We partner with Amazon. I'm like, okay, have you ever shipped a baby? And so that just reminded me of that. But in terms of funding,
Mm.
so when I completed the Hopkins program, I was awarded their inaugural $25,000 seed investment, which was a huge catapult to media. Media was something I had never prepped for, I had never planned for, but I'm thankful for, because it got me notoriety in some weird kind of validative way. And people donated. Within 3 months, I had roughly $250,000 that I used to do some really intentional pilot programs with emergency intervention places like the House of Ruth, um, private insurance like Chase Braxton, um, so that I could have data on very specific pockets of people. And also for the homeless population, I partnered with the Youth Empowerment Society, which was a drop in youth shelter that had a number of transient and homeless youth. And so these were really intentional pilot programs that I set up and was able to fund myself, so that when I went to partner with strategic agencies, I already had data generated because I didn't have any data. So my data was like gold.
Right, right. So now you've got contracts with a lot of different sources that pay you as a vendor to provide this product and these services, right?
Yeah, and so it was over the last year, especially the model did a complete 180. And while I had been talking to people and people had been talking to me, like, why aren't you trying to, become bigger? Why aren't you like, why can't I walk in Target and buy this? And I'm like, no, 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 no. We love doing home visits and meeting with the people. Like, that is what we were built on. That's
Yeah,
what
and then all of a
we
sudden you couldn't go into people's houses anymore.
and then we got locked down and couldn't go to anyone's house. And so we did pivot to a B2B, a business to business model. And so essentially we did become that big bang box mover, manufacturing, moving arm of this world that we call making boxes. And while it has freed up a lot of capacity, I do miss seeing families. I do miss hearing just that qualitative information that they would give, some unsolicited, some not. I think that the pivot was good, but it's also really uncomfortable because it's growing, and so we are on track to be in at least 50% of the state. And my goal when I started in 2016, 2017 was the whole state. Every baby can, every week we care. I think I had a whole mantra like Maryland support safe sleep and some wild little mantra that I had under it. But that's actual a reality now with this model, and a lot less capacity behind it. And
Right.
so it's really scary, but it works and it sustained us. I get to, eat my favorite foods, and the light still works when I click it at home. So,
Hey, entrepreneurship that keeps payroll going is a good thing. So you're in 26 states now?
whoa, no jurisdictions within Maryland. I'm still within Maryland.
Okay, okay, okay. So half of the counties in Maryland
Yes.
is where you are now. Okay. So do you intend to go back to the home visit at some point in time, or are we kind of past that?
We're past it. It's way more lucrative. It makes more sense to let agencies that already have populations that they have the capacity to cater to in a much more intentional, well-intentioned way, and for us to focus on what we do well, which is make solid, eco-friendly, simplistic sleeping spaces for infants. Um,
Yeah, and that's such a fascinating sort of enlightening point for the entrepreneurial journey, right? Because you pivot and you twist and you turn over that, but eventually you figure out, you know, what is it that I'm exclusively really good at, and what of all the stuff I do, are there other people that are just as good that can do that, so I can focus on this one thing. That's absolutely
it is such an
spot on.
awakening. It's an
So
awakening.
so what's the next 3 to 5 years look like?
The next 3 to 5 is to take over the world. To take
Once an
over.
entrepreneur, always entrepreneur. Well, we could do this forever, but we're starting to see some questions pop up in the chat. So Taylor, can you give us a hand here? And
Absolutely. So Kendall asked, how I would love to hear more about how in which the families and communities that this product would benefit learn about this product, service, and opportunity.
So
and by the way, Shantell, you feel free to call on folks and ask for clarification. They can pop open their mics and talk to. So whatever you want.
absolutely. So Kendall, I think what I'm hearing you say is, how would families find out about the product?
Yes. Hi.
Hi. So the old model, I would say, oh, here's the website. They can submit a referral, and we can respond to them in 2 to 3 business days. The new process, however, and I can provide this for you, is we would refer you to some of our strategic partners throughout the state. And so they would need to be connected to one of those partners to actually get one. What I am happy to say is once they are connected to one of those sites, they are free for them. But we don't do direct with B2C. I'm trying to use all the business lingo, Dr. Kuchar.
So you can't just walk into a store and say, give me one of those.
No. Everything is data affiliated. And so it has to come from one of the partnerships. But I would love to provide you the information of partners for yourself and others.
I appreciate it. Thank you. I'm a BSN student, soon to be graduating, and I am passionate about this because I am entering the field of medicine and nursing. And so learning about your story has been fulfilling and a true joy. So thank you for sharing that with everyone here.
And thank you for your service. That field is not for the faint of heart.
Yes.
Great. Thanks, Kendall. Thanks, Shantell. So we have another question here from Faith. Were you afraid of starting, and how did you overcome that? That's a good question.
Was I afraid of starting? Absolutely.
Has it gone away yet?
No, I just said I'm terrified of what the next 3 to 5 looks like because it stretches you. But the reality is, and I saw this quote, if you're not doing something every single day that makes you uncomfortable, you're not growing. And so you should be pushing yourself to grow and knowing, and I'm not, a hyper religious person, but my grandmother is. And she always says, it's not about you. It's about the Lord. And it's about the people seeing the work of the Lord through you. And it's funny because people say, girl, you're doing the work of the Lord, saving those babies or the school system or whatever I'm doing. But it's not about me. And if you think about it in that way of every day that I don't live in my calling and my passion, how many other lives am I affecting negatively? What's the unintended consequence of me not working in my purpose? And when you think about it that way, you feel really trashy to not do it. You feel really bad. Like, I'm so selfish that I'm not helping other people live their purpose.
There's nothing more powerful than a grandma looking over your shoulder,
Like, girl, it's not about you. I'm selfish. Like,
well,
okay,
it's funny too, because I think part of the question is also about that first leap, and one of the things that we talk about a lot, and I know you had this experience a couple of times, Shantell, is that, one of the other myths of entrepreneurship is that it's this huge risk and it's this huge leap into sort of this abyss, and the reality is you test and build and try, and you do still have to take a leap, but you take a leap with information and background and support so that it's a calculated risk, not a blind risk.
Yeah. It is. But I think that's something that in this world so there is, when you define risk, right, you think about risk, okay, is it high dollar risk or is it high reputational risk? Or and somewhere in there, you think about self-preservation, you think about, you may think about unintended consequences, but risk exists in everything. And so me not doing anything is risky. Me doing something is risky. Which risk am I willing to assume?
That's a great point. The risk of inaction is also a real
Risky.
thing. Yeah, it's a great point.
All right, we've got more questions. They're just coming in. So Wendy asked, have you looked at a collaboration with nurses and nurses family partnership, or are you already doing it? I'm assuming nurses and family partnership, or are you already doing it? Maybe, and if you need clarification, I'm sure Wendy can jump in and provide some.
So interestingly enough, because of my time at the health department, there is a nurse family partnership component to it. So she could very well be saying that, or the latter, the nurses and family partnership. So I'll respond to both, yes and yes. So 2 years ago, we did have a small pilot that went alongside, not particularly with the health department, but with through the Baltimore Be More for Healthy Babies collaborative umbrella. So we have collaborated, that doesn't currently exist because it was a pilot. And the Baltimore City Health Department alone has chosen to have a neutral positioning on the box. Okay, so I'm gonna tell y'all a secret, especially for Baltimore City Health Department. I was working there when I launched this, right? And so they came up with this neutral statement that had nothing to do with what I was doing, even though I was the only person in like the eastern region of the United States doing this. That had nothing to do with me. And so the Baltimore Sun did an article on me in this box, and I'm giving them all the data. And of course, like a good reporter, they reached out to the health department to validate the data I gave them. And so they were able to kind of get Dr. Lena Wynn, the infamous, they were able to get her back against the wall and say, listen, we need a quote. And what she said was, if Touching Young Lives can offer a portable alternative crib to a family that does not have any other viable sleeping option, it is a safe infant sleeping space. And I was like, oh, there's the $64,000 ticket. Lena said it. And Lena said it, it's gold. And so we put it everywhere. It was in data. It was in the grants. It was on the website. Listen, it wasn't a yes, but it wasn't a no. And so we have just been running with it.
And for those of you that aren't keeping score at home, she's referring to the person who at the time was the Baltimore City Health Commissioner. So that's great stuff. Kendall, you said you had a follow-on question to the nurses and family thing, right?
Yes, I just wanted to learn more on how in which like we as nurses can support you, because as nurses, we are advocates for our patients and educators,
Right.
you know, and so I wanted to learn more about your relationship with them so we can serve.
I think what I have done, and the part of entrepreneurship is also being vulnerable and honest subjectively, is I didn't particularly massage that relationship with a lot of practitioners like I should have. I was so focused on the end user that sometimes you forget about those steps in between, and you don't. And it was a capacity issue, which is something we didn't even talk about. We could do a whole other conversation around just capacity building so that you can maximize those different types of pipelines so they can be ambassadors on purpose, and sometimes not so much. But I didn't do a good job at that. I didn't do a good job at a lot of things. By the grace of God, we're here and flourishing. But Monday morning quarterbacking, looking back over some of those relationships that I probably could have flourished, done better with, and that is definitely a population of people that actually were very helpful in the small scale that we did have. So like when I told Dr. Kuchar that there were practitioners, nurses, social workers, family health, community liaisons between families and myself, they would send referrals. And so then we were able to then go back to the hospital and say, hey, over the last fiscal year, you all had X amount of referrals from your hospital. Let's have a larger conversation. And so that was something that in my past life, in the past model, that I would be interested in. In this newer model, it's more about the warm handoff to the existing partnerships that exist, because they can provide for them the holistic care more than we can. We're just one piece of the existing pie.
So I want to get, is it Sharon or Sharon? I want to make sure I pronounce your name properly.
Yes, it's Sharon.
Sharon, that's what I thought. Okay, thank you. So Shantell, Sharon wanted to know about money. And I kind of got at money, and you sort of danced past it. So I'm going to pull you back as well.
Okay.
So thank you, Sharon, for grabbing that as well. So what she wanted to know was about, how the funding sources shifted as you went from nonprofit to for-profit. Right? Am I understanding your question?
So for the seed funding, any money, in-kind donations, family, my goodness, what was it? My stipend money that I got from the fellowships, all of that was money that went into the nonprofit side of being able to distribute the portable alternative cribs for free. And so I was able to do the pilots basically free of cost because they paid for themselves. And just for perspective, the cost of a manufacturing a crib, that is the actual device, the handles, the mattress, and the mattress cover, is just under $11. And that's an increase. When I started, it was about $8.68 each crib.
Amazing.
And that was a full package deal. And I drew the line there because what the manufacturer would do for me is package them individually. And that would have been an extra $2. And I said, absolutely not. That's where I draw the line. We can package them ourselves because some of these don't need to be packaged. And so selling them for $25 at a discount was still a humongous margin. And so selling them for $50, and we advertised a super, now it's cliche, everyone has done this, but at the time it was still relatively fresh, the Tom's model of buy one, give one. And so that was my whole pilot process of, okay, if you purchase a crib for $50, not only do you have one, there's one for a family in need. And everyone loves that. Like, oh, well, I'm going to spend $50 on a bassinet. I'm going to spend $200 on a bassinet. So you're telling me I can use an eco-friendly one. I can move it around. It was, produced, and it's a black female owned business. Like, I'll do this. I'll buy 5 of them. And people did. People really did purchase them in mass in that way just to support the social cause behind it. All the while on my side, I'm like, I can't believe people are paying $50 for these things that I create for $10. $10. And I remember even coming up with the pricing model strategy, like, people are not going to pay $50 for this until they did it. And that I had my proof of concept. And so once the proof of concept actually worked and it scaled on itself, if someone asked me about being scared, I was scared as hell because people were actually buying into this product and into my vision. Like you dream of these things and you say, okay, I'm gonna do it. And it's like one small thought in your mind that you're hopeful that it doesn't work, because if it works, then you have to make it continue to work.
There's a great old line I heard from a successful entrepreneur one time that said, the early stages of entrepreneurship versus the latter stages, and the analogy he used was, it's like the dog that has been chasing the car and finally catches the car, and all of a sudden realizes that he's being dragged down the road at 50 miles an hour with a mouthful of bumper.
Right.
And you're like, oh my God. So our good friend Al Essian is with us today, and Al had actually a technical question about the safety rules.
Mm-hmm.
and how that whole world has evolved for you.
So when I first started, because we didn't want to say, okay, these hadn't been tested, that there were no safety guidance to them. And
that would not be a good marketing move, would it?
That would not for, new parents or even just for ourselves, because it's a huge liability in the realm of infant and child products. It is a huge, a huge liability market. And so what we started doing is we would have them tested, which is a whole process of, okay, we're going to fall under the category of bassinets. We're going to undergo the same testing. So that's mold testing, that is for the mattresses, there's testing. For the actual bedding, there's testing. And essentially they were tested as if they were traditional bassinets. And even in the testing world, you don't test every singular device. What you do is you create a subgroup of what you intend to sell, and you have those tested. And the results of those tests are essentially what you go by when you say you've been tested. So I don't know if people knew that. So just wanted to offer.
You send them a sample, essentially a small sample of your product, and they test those.
Yes.
Right.
And so to your question around the standards, so there's been a baby box collective for the last 5 years because of the fact that there has been no regulation around it. It was such a new product in the United States, there was no regulatory around it. And so these calls would get absolutely crazy because you had people from across the country that you pro baby box, anti baby box, traditional crib makers, everything. It would be on this call. And so, of course, you know, the traditional crib makers from Graco were like, I don't particularly see a space. Why do we have to change regulatory measures in this arena? We've been doing this for 100 years. They're new here. They, you know, well, what if you wet it? Then, you know, how does it pass mold testing? And you're like, okay, what would you do if you wet a regular crib? And so they would get absolutely crazy. So where we are now is the recommendation is for baby boxes to be considered under the same regulatory category as traditional bassinets. And so without the authorization of the Academy of American Pediatrics, there is still no governance around it. There are parameters that companies like myself can do to ensure that we lower the opportunity of liability. But there is not an actual ruling. It's just a recommendation. Does that answer your question, Al?
Yes, it does. And you know, I asked the question because I was approached by a funder who was very interested in early childhood education.
Mm-hmm.
And baby boxes is one of the things that they were recommending. And a lot of the things that I saw online was that it works, but there's no actual research to support that it really works, with the Finland study, with the Tempo and all the different places that are being used. But I may be able to connect you with, because you can speak to it much more better than I can, if you're interested. So I'll get your contact from Jim so I can connect the person with you so you can explain it. They were really interested in something like this.
Absolutely.
And in full disclosure, Al is one of our extremely talented philanthropy department folks at UMB, and knows everybody, knows a whole bunch of stuff. So, all right, Faith, you just jumped on camera there. I'm wondering if you have one last question. We got just time for one last question, or if you just want to say hey, or if you've got a product of a baby box there sitting next to you.
She wanted to say hi. So
Hello.
hi.
Isn't that wonderful? That's I can't think of a better way to end this conversation than the only summary comment I would make, Shantell, is I really wish you would work on your enthusiasm, because it's just, you know, you're just so low key and so quiet and so calm that it's hard to get energy out of you. So, you know, you might want to just work on that a little bit. Thank you, Shantell. Thank you everybody for coming. We're thrilled to have you here. I think most of you know how to find us, but if you don't, I'm Jay Kucher, Kucher at umaryland.edu. And I look and see Taylor typing, so he's probably dropping email contacts into the chat. There's Taylor's. Thank you very much. And if you need Shantell's, we can get a hold of her.
Just put it in the chat.
See, you guys are so good. You guys are so good.